Hello, this is Dr. David Green, CEO of the Washington Pain Network. Today's topic is radiofrequency ablation for back and neck pain treatment. Back pain affects 90% of Americans at some point in life. It's the second most common reason people go see a doctor, just behind the common cold. It's a leading cause of disability in those under the age of 45, and it's seen in up to 40% of those who undergo low back surgery. Neck pain affects about 10% of the population at any point in time, up to 45% each year. 50 to 70% of individuals have neck or shoulder pain at least once in their lives. When you look at the cervical or lumbar facet joints, this is looking at the back of the spine, there's little facet joints on the left and the right side. They're about the size of a thumbnail. Collectively, they provide incredible range of motion for the spine. There's another one here and here. But they have cartilage, and they're prone to arthritis just like other joints. The facet joints are the cause of back and neck pain 45% of the time. 40% of the time it's coming from the intervertebral disc, and the rest of the time it's either coming from the SI joint or another cause. There really is no successful joint replacement for the facet joints like we have for the hip or the knee. Making the diagnosis of facet joint arthritis is a collective effort, looking at the history, physical examination, x-rays, maybe a CAT scan. Here's an example of a CAT scan. So here you have the vertebral body, spinal canal. These are the facet joints, okay? They look nice. There's an excellent joint space here. There's no rattiness or bony overgrowth, as compared to this one, where you have almost no joint space here, bony overgrowth, bone spurs. It really is significant arthritis. The interesting thing is that you may have a spine that looks like this, a joint, and you may have no pain at all. So it doesn't always correlate with how bad a person's pain is. So it ends up being a little bit of a coin toss. So severe pain may be accompanied with very little arthritis in imaging studies, or vice versa. Even the best trained spine doctors, fellowship trained, board certified, they get it wrong 50% of the time. So one of the best injections are diagnostic injections into these suspected arthritic joints that are causing pain. Okay, medial branch blocks are injections that go around the joint and numb up the little medial branch nerve endings that supply sensation to the joint. There's also joint injections that go right into the facet joint, and that's akin to doing a steroid injections like into a knee or a hip joint, same type of concept. A positive result with the diagnostic injections, anywhere between 50% pain relief and 80% pain relief, depending on which study you're looking at, but that is indicative of the facet joint causing the pain. Some insurance companies require 80% pain relief on 2 separate injections before they'll approve a radiofrequency ablation procedure. So, positive result would be a medial branch block may provide pain relief for 3 months on average. So it's not only a diagnostic procedure, it's also a therapeutic procedure. When pain relief wears off, it can either be repeated or the person can move on to a radiofrequency ablation. Other names for radiofrequency ablation include radiofrequency neurotomy, medial branch neurotomy, medial branch thermocoagulation, denervation, lesioning. They all mean the same thing. So 5 facts about radiofrequency ablation. The current that used is the same wavelength as radio signals, but there's no FM radio involved. It may be on in the room while the procedure is being done, but it doesn't have anything to do with the procedure. It actually can be more painful right afterwards. We'll talk about that in a moment. Pain relief may last for upwards of 2 years. You do need to have the diagnostic injection prior. Insurance companies won't approve going right to the radiofrequency. And it's been revolutionary for back and neck pain. I mean, it's one of the top 3 pain management treatments over the last decade. Well, what exactly does it do? Well, it doesn't do anything here. These are the nerve roots, okay, coming out. It does not affect the nerve root. What you're doing is you're affecting these, the medial branch nerve endings that supply sensation to these facet joints. So for instance, if you're working on this joint, see how it gets a medial branch coming down and then another one coming up? So you actually need to do the radiofrequency to ablate both of those. So here's where it goes, right down here, away from this nerve root, away from that nerve root, right over the nerve endings. The radiofrequency procedure first involves placement of catheters. They're basically needles that go in that have the thermal energy go across them. The latest machines are able to do 4 at one time. And once the catheters are in place, the pain doctor will do an initial burst of electrical stimulation to see if the patient's leg jumps or arm jumps if it's up in the neck, just to make sure they're not too close to a nerve root. Usually the catheter is heated up to 80 degrees Celsius for about 90 seconds. It's not always going to be like that, but that's just the average for your regular medial branches in the neck or the back. For other areas in the body, such as occipital or other, you might do a pulsed instead of a continuous for 90 seconds. Anyway, it deadens the medial branches, and it's an outpatient procedure that takes less than an hour. The results of radiofrequency ablation procedures have been nothing short of remarkable. Pain relief is seen for up to 2 years. The average in several studies has been shown to be about 15 months. 80% good to excellent results. And actually, repeat studies show that if the pain comes back, then a repeat radiofrequency can give you the same beneficial results. Significant and longer lasting pain relief compared to steroid injections with greater range of motion, lowered use of pain medicine, and a short recovery time. The complications: there's a potential increased pain for a week or so due to spasms prior to getting amazing relief. You may have increased pain for months if the nerves are only partially coagulated. That occurs in less than 5% of patients. Might have some slight numbness of the skin over the procedure site. Very rare spinal cord trauma. The average pain relief in one study, as I mentioned, was 472 days, 15 months. And then the repeat procedure often gives the same results. In Washington, the top pain management is through the Washington Pain Network. There's multiple clinics throughout the state accepting over 50 insurances and providing over 25 treatment options. The average success rate is over 90% with the board-certified award-winning doctors. Visit us online today at washingtonpainnetwork.com and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Green with the Washington Pain Network. Your pain stops here.